Good morning, Chairman. We're ready to begin.
Thank you, Denisha, and welcome to everyone that's on the call. And to start with, Denisha, would you please call the roll of board members?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Tommy Hopkins. Tommy Hopkins. Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Kathleen Ruth,
Present.
thank you. Anthony Williamson. Chairman, that concludes my roll call.
Hey, this is Hopkins. I'm here.
Thank you, Dr. Hopkins.
Thank you. Thank you, Denisha, and thanks to the board members for taking the time to participate this morning. And we do have a quorum to conduct business, so I will call the meeting to order. First thing on the agenda is a request our secretary, Dr. Rucker, if she has had a chance to read the minutes of the August 8th meeting and would recommend that they be approved.
Yes, Chairman, good morning. I have reviewed the minutes for August 8th and I found them to be in order. I recommend they be approved as stand.
Recommendation's been made for approval. Is there a second?
Dr. Cole, second.
Dr. Souls, as Coles has seconded that motion, all in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, they are approved. And the same request now for the minutes of the August 22 meeting, and ask Dr. Rucker if she's had a chance to review those and recommends approval.
Yes, I did review those minutes for August 22nd. I find them to be also to be in order and I recommend they be approved as stand.
Thank you very much, Dr. Rucker. Is there a second to that?
Folsom, second.
Roger Folsom has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, they are approved. Next on the agenda, in my opening comments, will cover the subject that is required in our bylaws, and that is an annual appointment and vote on elected officers to the board, those positions being chairman, vice chair, and secretary. And I have, as chairman, appointed a committee, a nominating committee, consisting of a chairman of that committee, Anthony Williamson, members of that committee, David Cruz and Dr. Hopkins. So that three-person committee have accepted, and they will be reviewing the officer slate and will come for the October meeting with a recommendation to be voted on for the slate of officers for the annual vote. And so appreciate their service, and that will be covered in the October 10th meeting. Thank you. Next on the agenda, we had an audit committee meeting this morning, and chairman of that committee is David Cruz, and asked David if he would give the board a report of our meeting.
Thank you, Mr. Chairman. We met this morning. Dr. Ruth, Dr. Hopkins, Chairman Board were present with me for the meeting. We heard a report from Joe Hood, our Chief Operating Officer, Sonia Allen, our Inspector General, and David Chong, our Deputy Inspector General. The report focused on the fiscal year FY23 audit findings, and they went in a great deal of detail explaining the audit findings and the work that the department has done to resolve those findings. There were 7 findings. 2 have been resolved and 5 are carryover findings to the current fiscal year. But there are plans to address all of those findings, and we heard about that in detail. So we spent the entire meeting just focused on that particular audit, which was completed actually in May of the current year. Obviously, the FY '24 audit is underway currently, and we'll, of course, be hearing about that later. So that concludes my report, Mr. Chairman.
David, are there any questions or comments on the audit committee report? Hearing none, we'll move to the commissioner's report.
All right, thank you, Mr. Chairman, and members of the board attending virtually, and those of you following at your respective homes. It's great to be here for a September 2024 board meeting for the Department of Community Health. I hope everyone's doing well today. I also want to thank Sonia and her team and Joe and his team for their work on the audit committee and all matters pertaining to that. They take those items seriously and they always have a great record of addressing them and promptly getting the department in the proper position on those. And typical Joe fashion and typical DCH fashion, Joe hung up from that audit meeting and is now testifying across the street in a Senate committee discussing EMS. So we're always trying to be responsive to all the different needs, and appreciate Senator Kirkpatrick including us in that agenda. And sure that's going well. And while our agenda may not look full today, as far as individual items, I believe you'll find these items we're covering quite comprehensive, namely the initial presentation of the proposed rules associated with this past session's passage and subsequent signing of HB 1339. As many of you know, HB 1339 was as significant a certificate of need debate as we've had in some time. And the fact that it's supported by proposed rules that totaled 309 pages in today's packet, I think can shine a little light on how robust that debate was this year. And I obviously want to lead by thanking and acknowledging the countless hours of work that's gone into just getting us to this point, to initial adoption, knowing that so much work lies ahead. Namely Carisha Lang, who as Executive Director of Health Planning, not only has to help quarterback the rulemaking effort, but always keeps an eye on the operations and staffing and resources of putting these items into play. And obviously thank her for her strategic vision in that space, and working alongside Carisha's team, Melanie Simon, Stacy Hillock, and Brian Anino from a legal perspective, and Dr. Burke and Emily Yona with their legislative and government perspective. Obviously, Dr. Burke with his clinical perspective, and Brandy Sylvan and Caitlin Ward, who helped guide us, navigate us through session on to get us to the product we looking at here today. But as I again acknowledge, make no mistake, we fully recognize this is the first step of the process, because I hope everyone knows this and everyone watching at home. We take the public comment very seriously, and we pay attention to it, and where items need further attention and further interpretation and further thought, we will do that, and know that it could a new product could be standing before us for final adoption, and we're always open to that as long as it stays within the line of the intent and spirit of the law. That's why these processes are open and in place. So thank you to the team, and thank you in advance for your work that will continue, and thank you for the public for being active participants in this. So if I may, knowing that we have a lot to cover, Mr. Chairman, I'll pivot to our service milestones. We'll kick off with a couple of 20-year milestones. Kimberly McDaniel, HFRD, Tavis Williams with SHBP, Emma Carlin with the Board of Dentistry and Pharmacy, all at 20 years. A couple of 10-year milestones, Sandra Fuller at Financial Management, Stacy Ramsey at MAP, 5 years, Shanta Manuel at HFRD, Brian Anino, the Commissioner's Office, aforementioned, legal, 5 years. Melinda Wilkinson, 1 year, General Counsel. Paulina D'Alba with Opie, 1 year. Kayanne Richards, at Opie, 1 year. Brennan Rojas, HFRD with 1 year. Dusty Todd and Juanita Bonds, also with HFRD at 1 year. And we're grateful for everyone's tenure, whether it's 20 or 1 year. Thank you for being a part of the team. As we always like to say, thank you for jumping in the deep end with us. And we're very grateful for how much the team has grown over the past few years. Appreciate all the division directors' emphasis on recruitment and the strategic side of putting us in these positions. So with that, Mr. Chairman, I'll defer back to you in the agenda.
Thank you, Commissioner. Are there any questions or comments for Commissioner Carlson, please? Hearing none, on our remainder of the agenda today, we're going to be asked as a board to vote on 1 item for final adoption and 3 items for initial adoption and a presentation on the OnMed program at the end of the meeting. So first of all, in medical assistance plans that we'll be considering for final adoption, Stuart Portman will make the presentation. Stuart, please.
Good morning, Chairman Boyd, members of the board, and Commissioner Carlson. The Hospital Medicaid Financing Program is used to assess 1 or more provider payments to hospitals in order to obtain federal financial participation for Medicaid. Per the enactment of the Hospital Medicaid Financial Program Act in 2013, and subsequent reauthorizations, the program was extended through 2025. Per the provisions of House Bill 991, this past legislative session, the Hospital Medicaid Financing Program was extended through June 30th, 2030. An opportunity for public comment on this state plan amendment occurred on August 14th, 2024 via Zoom. No comments were shared, and additionally, no written comments were submitted. The department requests final adoption to extend the program through June 30th, 2030. Thank you.
Thank you. And my understanding, Stuart, this went out for public comment, as is our process after initial, and there were no public comments.
That is
either
correct.
pro or con. So is there a motion from the board for final adoption?
Motion for final adoption, Cynthia Rucker.
Dr. Rutgers has made the motion for final adoption. Is there a second?
Second,
Dr. Cole,
Hopkins.
second.
Dr. Cole has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you, Stuart. Thank you for providing the information to us in advance that we could review. Thank you. Next on the agenda for consideration for initial adoption, Lynette Rhodes will make the presentation on medical assistance plans.
Good morning, Chairman Boyd, Commissioner, and members of the board. As always, it is a pleasure to have the opportunity to present. Pending approval from the Centers for Medicare and Medicaid Services, effective September the 13th, the Department of Community Health proposes to revise the methodology for distribution of the supplemental quality incentive payments to eligible skilled nursing facilities and the CMS long stay quality measures utilized. By way of background, in state fiscal year 2022, per the provisions of House Bill 81, which was the appropriations bill, the department was directed to increase the supplemental quality incentive payments to eligible skilled nursing facilities. Using the CMS long-stay quality measures, the department developed a quality incentive plan that identified 4 specific areas where Georgia ranked below the national average. The 4 areas were in high-risk long-stay residents with pressure ulcers, long-stay residents who received an anti-anxiety or hypnotic medication, long-stay residents who received an antipsychotic medication, and the 4th measure was long-stay residents with a urinary tract infection. Using the calendar year 2020 data as the baseline, nursing facilities that demonstrated improvement in 1 or more of those 4 areas were eligible for a supplemental payment. The supplemental payments were based on the percentage of improvement ranked by decile for each of the 4 categories. For each subsequent year after 2020, the base year was adjusted annually to reflect improvement against the prior year. So we are changing that moving forward. We are proposing to revise the methodology for distribution of the supplemental incentive quality payments to eligible skilled nursing facilities, and again, the quality measures utilized. Going forward, the department will notify the skilled nursing facilities of the new quality measures no later than September 30th of each year, with the first revision occurring in 2025. This new approach will allow the department to revise the quality measures annually as appropriate instead of utilizing the same 4 measures moving forward. The supplemental payment will be based on each nursing facility's overall ranking in each of the long-stay quality measures, resulting in the nursing facility receiving a payment proportional to their improvement. For example, a facility with the highest improvement will receive the highest supplemental payment for that particular measure. The payments will be distributed to the eligible nursing facilities once per year. And for each subsequent year after calendar year 2023, the base year will be adjusted annually to reflect improvement against the prior year, as it's been done in the past. Only those facilities that demonstrate improvement will be eligible for the add-on payment, and only those facilities with 50% or more Medicaid long-term residents are eligible for this program. An opportunity for public comment will be held on September the 18th at 2:30 p.m. via Zoom. And written comments are due on or before September the 25th. I will pause now for any questions from the board. And I think one last point to mention, the funding for this remains the same as in the previous years. And so the total funds is $36,253,000. And the breakout of that is 12 million represents state funds, and the federal funds portion is 24 million. I'll pause now for any questions.
Thank you, Lynette. Are any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion to approve, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Second the motion, Kathleen Root.
Dr. Ruth has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved for initial adoption. Thank you very much, Lynette.
Thank you.
The next item, Carisha Lang will present is the rules and regulations for health planning for initial adoption.
Good morning, Chairman Boyd, members of the board, Commissioner Carlson. The Office of Health Planning will be presenting 2 sets of rules this morning for initial adoption. Thank you, Commissioner Carlson, the DCH Executive Leadership Team, and the Office of Health Planning for their support and feedback throughout this process. It was very much a team effort. The first set of rules I will discuss is found in the department's rules and regulations at Chapter 111-2-1, Rules and Regulations for Health Planning Administration. A draft copy was provided to you. The proposed changes reflect amendments to the State Health Planning and Development Act, OCGA Sections 31-6-1 et sec, resulting from the passage of House Bill 1339 during the 2024 legislative session, which was signed by the governor on April 19, 2024. The proposed changes update the health planning regulations so as to provide for review and update of the state health plan every 5 years to ensure the plan meets the evolving needs of the state. This change is reflected in section 0.01 and is the only substantive change to this chapter. I would like to note that the state health plan, as referenced here, is a compilation of the various need methodologies, standards, and rationale used to evaluate projects involving facility types, services, and programs that require a certificate of need. A public comment hearing will be held on October 8th at 11 a.m., and written comments will be due by October 11th at 5 p.m. The department is respectfully requesting consideration of these rules for initial adoption. I will be happy to answer any questions you have regarding these proposed changes.
Are there questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
So moved, Hopkins.
I'm sorry, I couldn't hear who that was.
Hopkins.
No, Dr. Hopkins has made the motion for approval for initial adoption. Is there a second?
Second, Dr. Rucker.
Yes, Dr. Rucker has seconded that motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? It is approved.
Thank you. For the next agenda item, the Office of Health Planning presents for initial adoption revisions to the rules found in the department's rules and regulations at Chapter 111-2-2, Rules and Regulations for Health Planning Certificate of Need. A draft copy was provided to you. These revisions are necessary in order to reflect legislative amendments to the State Health Planning and Development Act at OCGA Sections 31-6-1 et sec, resulting from House Bill 1339, as well as to correct grammar and to provide clarity. The proposed changes make updates to the health planning regulations so as to revise and provide for new definitions relative to health planning and development as reflected in section 0.01, to clarify when a certificate of need is required, which is located at section 0.02, to revise and provide for new exemptions from certificate of need review at section 0.03, to update fine amounts for deficient survey reporting at section 0.04, to update language for providing notice of a revocation at section 0.05, to revise provisions relating to certificate of need review requirements at sections 0.06 through 0.09, to revise and update the requirements applicable to requests for letters of determination that an activity is exempt or excluded from certificate of need requirements at 0.10, and to update the service-specific review considerations to align these changes at sections 0.20 through 0.42. A public comment hearing will be held on October 8th at 1 p.m. and written comments will be due by October 11th at 5 p.m. The department is requesting consideration of these rules for initial adoption, and I'll be happy to answer any questions regarding the proposed changes.
Questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Folsom motion for approval.
Roger Folsom has made the motion for approval. Is there a second?
Second, Dr. Ruth.
Dr. Ruth has seconded that motion. All in favor, say aye.
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 Opposed,
Just a minute.
abstaining? Hearing none, it is approved, and we'll look forward to the public comment that Commissioner addressed also earlier in his opening comments. So I'm sure there will be some.
Yes, thank you.
Thank you. With that, that concludes our items that for consideration for voting today. Now I'd like to call on Louis Amos, the Director of State Health Benefit Plan, to make a presentation on med.
Morning, Chairman Boyd, members of the board, Commissioner Carlson. I'm excited today to bring a brief presentation to you regarding the OnMed Health Station. So if we could cue up the presentation. While they're queuing it up, Chairman Boyd, I could go ahead and make the presentation without,
Okay.
for the benefit of the committee. The OnMed, there it is. I'll go ahead and talk a little bit about OnMed. The OnMed is a digital health company that helps people manage their health care in one place. The care station is a unique hybrid delivery system blending virtual care, real-time convenience with the benefit of traditional care and the latest in health technology. OnMed is a leading health-enabled equity solution with the mission of improving the quality of life for primary care services at home and in the workplace. The station will provide free, and let me emphasize, free healthcare services for elected officials, legislative staff, state employees, regardless to whether or not they're covered under SHBP, and school system employees. It will provide health services that are essential in terms of chest x-rays, respiratory sinuses, eye exams, and an assortment of minor abdominal issues, as well as treatment of flu, COVID, and other skin conditions, blood pressure monitoring, and things of that nature. We feel as if it is, in fact, a game changer because what it's doing is providing access to healthcare services in the workplace. And this is the first and of its kind in terms of public sector entities that are entering into this particular area. I do want to thank Commissioner Carlson, Dr. Burke, and the executive leadership team for SHBP and DCH for their assistance in helping us to bring this to fruition. If we could, I'd like to show the video. There's a video that's available that kind of shows the patient experience. So we'll kind of share that, and then we'll entertain any questions that may come from the board. As it always seems like technology is not being real kind to us, but I'd like to, at this point in time, Chairman Board, entertain any questions that may come from you or the board as it relates to the OnMed health stations. Like I said, we are extremely proud that this is an opportunity in our partnership with ShareCare to extend the Be Well program. So here's the video. So while they're working on that, Chairman Board, I'll go ahead and take this opportunity to pause and answer any questions that the board may have.
No, this is something, this is new to the state health benefit plan. Is that
Yes, sir.
correct?
Yes, sir. It is an expansion of our Be Well program, and that's the program that we have in terms of we're trying to assist
And
state.
all participants in the state health benefit plan can benefit from this and use as individuals.
Yes, sir. It is,
correct?
it is available for elected officials, legislative staff, state employees, active state employees, regardless to whether or not they are covered under SHBP. And
Okay.
as well as school systems, because obviously we cover the school systems throughout the state of Georgia.
And there's no out-of-pocket additional cost.
No out-of-pocket costs. It is in fact a virtual care visit that you have the ability to speak with a nurse practitioner. The uniqueness of this is that it gives the opportunity for them to do temperature check. It has a camera that can really look in terms of really closer than you could do in some of the doctor's offices. If you had an ear infection or strep, anything of that nature, it has the ability to diagnose that. In addition to that, they have the ability to do electronic prescriptions. So once you leave the care station, you will have the ability to have your prescription sent to your pharmacist. And the uniqueness is it is no cost to the employees or to anyone who uses it.
Where will these
Other
things be
questions,
located?
comments?
Where will they be located?
Yeah, so the first one is located here in the Twin Towers on the balcony level. It's right outside the boardroom. We encourage those who are listening that if you come into the building, that we'll able to provide kind of a walkthrough and give you an opportunity to kind of go through the whole process. So we encourage those. There is an open house that's scheduled for next week, and the official ribbon cutting ceremony will take place on next Friday. And the hours of operation is 8 to 4 o'clock, Monday through Friday.
Other questions or comments, please?
This is Kathleen Ruth. I just have a comment. I had the unique and amazing experience with OnMed last month during our after our board meeting. And it truly is, to your sentiments, is a game changer. It was a great experience, and it was a very personalized experience and interactive. I mean, just really, truly revolutionary. So kudos to the department for bringing this to employees. It really is amazing.
Thank you for those comments. Any other comments or questions?
I do want to make a comment. Also, it's really impressive, this technology. I agree with everyone. It's really impressive. But how many locations are we anticipating?
Well, that's a part of the study that we're going to be doing as we look forth in the future. From a strategic standpoint, it's an opportunity, we feel as if, to go into certain areas of the state where there is, we have health deserts. So there is an opportunity to go into areas of the state where there may not be any primary care physicians, where there are not limited pharmacy services. And, this is in fact a game changer. We're looking at obviously working with the school systems and the state agencies that are in some of these areas. And it is the uniqueness is that rather than going through a process of spending an enormous amount of money on brick and mortar, you can pretty much put this station in place with a fraction of that cost, but even offer a higher level of service. So, as we look at throughout the state and look at some of the health deserts that are within the state, that would be a part of the plan. So obviously, we see it as a game changer. We see it as an opportunity to expand access to care throughout the state, and we will be looking to do it, within the remainder of this year and obviously next year.
I think that's
Thank you.
really
I would
great.
assume then that what you're saying, that we would, as we expand, we would prioritize those kinds of underserved areas of the state where this would be most beneficial.
Yes, sir. Yes, sir. And that's the whole concept of it is having the ability to provide access to care. And as we know, there are parts of our state that we really need to
Yes.
look at in terms of providing additional access to primary care services.
Other questions, comments?
I just wanted to also mention that it's great that it self-sanitizes itself, the air filtration system to cleanse itself as people come in and out.
Yeah, it is using the ultraviolet technologies, using the latest in terms of cleaning. And the other thing is that this station is monitored. So it's monitored 24 hours a day. And the OnMed, they have the ability, obviously, it's a secluded private, in terms of protecting HIPAA and all the other things. And once you go in use, you'll see it's you can't see in. And then immediately after the station, the visit is over, it goes through a cleaning process, an ultraviolet cleaning process, and it's using the latest technology. They also have the ability, if, for example, there is an issue, biohazard issue, an issue with somebody getting sick, anything of that nature, they have the ability to shut it down and to work. And here in the building, we're working with GBA to provide the services in terms of being able to clean it and make sure it's sanitized and we don't run into that issues. Secondly, they also have the ability in terms of if there's a need to call 911, we go through GBA and through Capitol Police Services in order to be able to have those services available. So I can tell you, since we've had it installed probably 2 or 3 weeks, we've had some scenarios where patients have gone in and the blood pressure and things were elevated to the point that they needed to get immediate medical attention. So, I mean, it is in fact a lifesaver in certain cases because, people are getting sick and, a lot of times it's going to the ER, but if you can help to kind of monitor that situation and triage it, then it gives us a better opportunity to provide a better level of care.
And I just have one last comment to make that it can address about 85% of typical primary care visits. So to the point around how important this would be in those areas, those desert areas, this could be very beneficial.
This is Dr. Coles. I have a couple of questions. I may have missed one. How is this funded?
It is an expansion of the Be Well program we have through Share Care. So it's a combination of our contractual relationship with Share Care, but it is an expansion of that program.
So it's funded by taxpayers? Yes.
The current funding is actually funded through Share Care in terms of some contractual relationships, in terms of how they are funded, and that's the way it's funded. And it's not a direct funding through taxpayers at this particular point in time. But if we look to expand, that may be a situation that we'll have to have discussions in terms from a financial standpoint.
So who pays for Share Care?
Well, Share Care is paid through the state. Yeah, it is state.
So it is taxpayer funded.
There's limited funded, Commissioner.
Through the plan, as we try to administer the plan for the state employees and teachers, it's an offering as part of our wellness program.
Right.
So just like any other plan, we're constantly trying to provide better services and have a customer relationship with the state employees. So I hope that helps answer it, but yes, sir.
Yeah, that does. And I know this sounds crazy, but I sense, is there any direct physician supervision of this? And I'm getting to malpractice.
Yes, so that is all covered through OnMed. They have the physician component. Obviously, there are licensed medical doctors who are licensed to practice medicine here in the state that are providing care. So there is, malpractice and all of those things are covered through the contract in terms of with OnMed. And this is what they do from a corporate standpoint. So there's physician oversight, malpractice, and everything you would have in a traditional physician office.
Other comments or questions? Hearing none, thank you very much, Louis. Thank you.
Hey,
Very
thank you.
interesting.
Thank the board for your support.
Does anyone know of any new business that should come before the board at this time? Hearing none, I thank you again for your participation today and taking the time to participate, all the board members, and have a good day, and we'll see you back here in October the 10th for the next meeting. Thank you.
Thank
We're
you.
adjourned.